If they have this gene, they have a 102% higher chance of you might go to your doctor at a much younger age than the usual recommendation. Internal hemorrhaging and typically die within minutes.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and Genesis, and I am joined again today by the wonderful Dr. Ellie Campbell. So let's dive into the 5 genes that you see have a huge impact on, the potential increased risk of things like kidney disease and chronic disease.
Right. So the first gene I'd like to talk about is called the heart attack gene. That's what it's nicknamed. And its genetic letter code is 9p21. And why this gene is important is it's not that rare. 25% of Caucasians and Asians are homozygous for this gene. So that's a huge proportion of patients. If they have this gene, they have a 102% higher chance of developing a heart attack or coronary disease at a younger age. Wow. So that's really high. They also have a 56% increased lifetime risk of heart attack and coronary disease compared to the general population. A 74% increased risk of developing an abdominal aortic aneurysm. So for those who don't know what that is, an aneurysm is a bubble on an artery, much like you get the bubble on a sidewall of a tire. That bubble can sit there for a while and not be a problem until just the right temperature, pressure, gradients hit it, it can burst. And if that vessel bursts inside your abdomen, you have internal hemorrhaging and typically die within minutes to hours of that rupture. It can be detected by an abdominal ultrasound, and smokers have enough of an increased lifetime risk that if you have ever smoked a pack of cigarettes cumulatively in your entire life, you should have a screening ultrasound at age 60 to see if your vessel is weakening and you're starting to get a little bubble on the sidewall. And so having this 9p21 gene and being a smoker significantly increases your risk of dying from that aneurysm. So if you knew at age 50 that you were a 9p21 carrier and you had smoked in your 20s and 30s, you might go to your doctor at a much younger age than the usual recommendation and say, I would like to be ultrasounded. Oh, and by the way, I'm really high risk for heart attack and stroke. I really want your full court press. Do everything we can do to reduce my risk. I don't want you to treat me like the average bear. I want you to treat me like I'm a super high risk patient. And having that conversation can kind of shake up your doctor a little bit. I've never had a patient come to me and say, I'm high risk. I want your full court, your full meal deal. What do you have for me that you don't do for other people because I'm high risk? I would love that, to have a patient be that engaged and interested. Yeah. And the final thing is, if you're a diabetic and you're poorly controlled, you have a 400% increased risk of coronary disease and a double risk of death because of having the 9p21 gene. So I think all of us should know our status. Do we have this or not? If we're higher risk, then we can be screened more carefully. And if we're not higher risk, then we can go look at some of the other genes and see what those might be playing a role in the background for our health.
Well, thank you. I appreciate you. Remember to hit subscribe and click like. That helps all our Google, our YouTube algorithms. If you want to know more about what we do, head to www.kidneycoach.com. Thanks for being part of our audience. Thank you for being proactive with your health. And Dr. Campbell, thanks again. Talk to you next time.
Yes, ma'am.
Bye.
Bye now.